Hello, this is Dr. Vosloo from Restore Bioclinic. We offer a specific program for patients with long COVID, in reality, post-viral or post-infectious conditions, and also specifically for long COVID and COVID vax associated onset of symptoms or injury. The duration of long COVID symptoms can be quite variable. It could be anything from a few weeks at the shortest, but some people experience months of problems. Usually, there tends to be a decreasing in symptoms unless your system has entered more of a survival programming called the cell danger response, and then it could mimic post-viral chronic fatigue syndrome, that there doesn't seem to be much change after a few weeks to months. So if you're especially in the latter category, that you look at the literature, you speak with your informed physicians, and you're starting to exceed the expected timelines for improvement with the current therapy that you're doing, this is literally the program that I want you to start looking at, because this is designed for you. Long COVID recovery is not a mystery. By now, we've figured out many components of it, and inasmuch as it is a multifaceted evaluation, certainly, with many, many data points that we need to take a look at, the recovery process from an immune, hormonal, and most certainly cell biology perspective, there's some very clear places that we need to go to first investigate and make sure that we understand what are the components for your situation, because there's, in addition to the observed timeline onset of symptoms, there's usually a longer context of it. You know, in healthcare or in health conditions, the last straw that breaks the camel's back is such an important concept. So for everybody that we've done a thorough assessment with long COVID or post-viral fatigue, it really seems like the stage was set and the COVID is but the final straw. So again, there's a multitude of data points that we gather. There's a really thorough physical assessment before we turn into adding clinical action items and treatments to what needs to be done. A lot of our patients ask, so how do I recover from long COVID? And the answer is, it depends, you know. Being more specific, depending on the specific puzzle pieces that are relevant for your situation, the treatment may last several months. But in general, with COVID and long COVID, if it turns into that, there's a few places that we've got to go. Most importantly, we have to ensure cardiovascular health and also adequate blood flow, which is one of the core concepts. Next, immune system function. In our long COVID cases, there's usually an immune system that is overactive, underactive, sometimes both at the same time. And very importantly, we have to make sure that we understand the cell biology of it. It's very much a situation of the actual symptomatic part of it comes and goes, but the footprints that it leaves on the cells and the remnants that it leaves behind is what really is so very important clinically. That's where we are able to get the most important information that allows us to add the most healing treatments to what needs to happen. So if you or somebody that you know or care about are interested in our long COVID program, check out the information below to see if this may work for you.